Good day, everybody, and I'm sorry I can't be with you. I thank you very much to FP 2020 for the invitation to provide a brief overview of the ECHO trial and the role of WHO, particularly in trying to ensure the results are used appropriately. We need to start with reminding ourselves what the challenge was that stimulated the ECHO trial. For many years now, there have been much data collected looking at the risk of HIV acquisition with use of different hormonal contraceptives. And over the last 2 decades or so, some data have emerged suggesting that there may be an increased risk for some hormonal contraceptives. However, the results from the research is very mixed, and it's not entirely clear what conclusions can be drawn from the existing research evidence. On top of this, we have to bear in mind that hormonal contraceptives are a very effective means of contraception, and they have in themselves tremendous life-saving benefits which we do not want to put in jeopardy. So we have before us a conundrum for public health in how best to provide services that meet the needs of all women in all situations. The goal of the ECHO study is to assess whether the risk of acquiring HIV differs with the use of 3 different methods of family planning and how that risk balances against the benefits of those methods. It's important to remember that this study is comparing the risks across the 3 methods, so comparing women using each of the 3 methods, but not comparing use of methods with women who are not using any methods. So it is a comparison of the relative risk across the 3 different methods. The study collected data across a large number of women. In total, 7,800 women participated in the study, ages 16 to 35. And these are all women who wanted to prevent a pregnancy, but were willing to use any of the 3 methods and had no objection to being provided with any of the 3 randomly. So the randomization process was 1:1:1, which led to 2,600 women using each of the 3 methods. The study has recently finished all of the data collection, and data analysis is currently ongoing. So we anticipate the results will be with us fairly soon. Given the importance of this study, it's critically important that everyone is ready for the results and that we don't just wait until the day that we hear the results. So over the past few weeks and over the next few weeks, WHO and partners are doing a lot of work to try to prepare for the results to come out. Already we've held a number of webinars to educate people about the study and the potential implications. This meeting today, hosted by FP 2020, is another good methodology for trying to ensure that the relevant people are prepared. We've established a UN working group for WHO, UNFPA and UNAIDS to work together and collectively on this. Already we've held a number of workshops in various countries to start the discussions going. There was a stakeholder meeting in Lusaka a couple of months ago to really plan through what needs to be done over the next few months. And in-country task teams have been established in each of the main countries with the highest burden of HIV and countries also where there is high level of use of these hormonal methods. Currently, we're in the stage of preparing various messages depending on the different scenarios that may emerge from the research, because obviously, as we don't know the research results, we need to anticipate different types of findings that may come out. And so currently, we've been developing a series of messages across the different scenarios, and as we speak, pilot testing these in a number of countries in Africa to work out which would be the best messages to use when we do have the final results. On the same day that the ECHO results will be announced, WHO will put out a statement which will outline the meaning of the results, the next steps, and the actions to be taken until our review of the existing guidance is completed. We've already begun the process, and we will finish it when the results are out, of reviewing the evidence around the issue of HIV acquisition by use of hormonal methods, and this time to include the echo results. And so it's important to bear in mind that we will not be looking just at the results from the echo trial, but we will be looking at those results in relation to the other evidence that has been built up over the last 20 years to give us a full picture of what the situation might be. Based on this review of the evidence, we will do the standard process for developing and reviewing WHO guidance, and if that process indicates that we need to change the guidance, then we will do that. Once the guidance either remaining the same or being changed as a result is put out, we will then engage with many partners, including yourselves, to disseminate these revised guidance as widely as possible and to help countries to implement accordingly. I mentioned that we are looking at different scenarios for the results. There are three main scenarios we're considering and we're developing messages around, but also it's important to bear in mind that this is a complex study with a lot of data being generated, and there are other scenarios that may possibly come out of the data as well. But the main ones we're looking at are first, that there may be no difference in the risk of HIV acquisition between the three methods. Secondly, there may be an increased risk of HIV acquisition for women using the DMPA injectable compared with either the IUD or with the implant. Or there may be increased risk of HIV acquisition for women using either the IUD or the implant compared with DMPA. And as I say, there may be other scenarios depending on women's personal situations, on the health system that the methods are provided through, in the general population characteristics concerning HIV, and many other factors which the analyses will be taking into account. The timeline for our communications strategies over the next few months is as follows, and broadly we've divided this into three broad phases. We've already convened national working groups in most of the main high burden countries, jointly with UNFPA and with the ministries, and these working groups are now ongoing. We're currently in the middle of implementing the first phase, what we're calling the pre-results phase of communication. And this, as I say, is primarily around developing the messaging, alerting civil society and ministries of health and other stakeholders that the results will be coming through and that the guidance will be revisited as a result of that. And we've already had a webinar to follow up on the progress with that first phase. And the first phase will continue right through until the release of the ECHO study results, which we anticipate will be sometime in mid-July. At the same time, as I mentioned, the results are released, WHO will put out a statement commenting on those results. Then there will be a short period of a few weeks between mid-July and the end of August, so about 5 or 6 weeks, when we undertake the formal guideline review process. We take a look at the existing evidence, we add in the results from the ECHO trial, and we revisit the recommendations to see whether any of them need to be changed. And that process, as I say, has already begun, but it will continue when hopefully should be finished certainly before the end of August. So by the end of August, depending on what decisions are made around the WHO guidance, we will then have a third phase of communications, which will focus on implementing and helping countries to decide on what to do with the guideline, whether it's been revised or has been kept the same. So in summary, in terms of the phase of developing the guidelines for WHO, as I mentioned, we've already carried out quite a few activities. We've established the planning proposal for the guideline review process. Later this month or early next month, we'll be announcing the guideline development group that will be reviewing the evidence. And we've already started to update the existing evidence on contraception and HIV, and specifically looking at values and preferences aspects of that. In July, the ECHO results will be announced, our statement will be put out, and we will then go through the process of updating the evidence that was synthesized earlier to include the ECHO results. And then when all of that is together, WHO's guideline development group will meet to review the evidence and decide what needs to be recommended in terms of the existing guideline we have, whether it should stay the same or whether it should change. That revised guidance will be sent to the Guideline Review Committee within WHO, which will then approve it for broader dissemination. And we anticipate, as I said, releasing the approved guidance by the end of August. I mentioned earlier about working with a number of countries. These are the primary countries that we've been working with collaboratively with our colleagues at UNFPA and FP 2020 and others. We are also working together with countries that have high use of DMPA but lower levels of HIV prevalence, and specifically working with Ethiopia, India, Senegal and Nigeria. So with that, I just wanted to thank you for your attention. I would be happy to answer any questions through email, and I look forward to hearing more about the outcome of your discussions. So thank you all very much, and I hope you enjoy the rest of the meeting.